Thank you very much, Chairwoman. Dr. McNicholas, earlier this year, Governor Northam of Virginia said if a mother's in labor, I can tell you exactly what would happen. The infant would be delivered, the infant would be kept comfortable, the infant would be resuscitated if that's what the mother and the family desired, and then a discussion would ensue between the physicians and the mother. Do you support Governor Northam's comments?
So I can't speak for Governor Northam, but what I can say is that there is no way to oversimplify the sort of the medical conditions in which people present in the second trimester that I think that he was referring to.
So as a physician, then what would be the harm in legislation such as the Born Alive Abortion Survivors Act to make sure that a child born alive would not be put to death?
So there are several harms. The first is using that language and perpetuating the notion that that is actually a real thing is harmful in and of itself. And it only serves two purposes. The first is to shame people like Jenny who need life-saving care in the second and third trimesters of pregnancy. It also creates an environment in which abortion providers like myself and my colleagues are targeted and harassed. So first and foremost, it is dangerous for those reasons. The second reason is because medicine is complicated. There really is no way for me to boil down more than a decade of education and practice to give you a single reason why doing such things is harmful to patients.
The answer should have been either yes or no. Earlier this year, thousands of fetal remains were found in the home of deceased abortionist Ulrich Klopfer. Do you believe that all fetal remains should be disposed of in a manner that treats them with dignity and respect?
Just like I believe that patients are capable of making a decision to continue their pregnancy or not, to expand their family or not, I believe that patients are capable of deciding what should happen to the remains of their pregnancy.
So is it okay for those fetal remains to be sold for profit by Planned Parenthood?
Planned Parenthood has never sold fetal tissue and currently doesn't and never has.
Does Planned Parenthood v. Casey give states the authority to regulate abortion in accordance with the opinions of their respective constituencies?
I believe that the most recent decision, and we have some policy experts on the panel who can speak more to this, but the more recent decision in Whole Women's Health set a precedent that restrictions must be based and grounded in science, and that's all we're asking for, is that abortion is treated to the current standards of medical evidence and science.
Ms. Stuckey, thank you very much for being here. Are there more federally qualified health centers than abortion clinics in the United States?
Thank you for the question. Yes, the ratio is about 26-to-1 of health care centers that are federally funded to Planned Parenthoods.
And which offers more comprehensive health services to women?
Of course, the health care centers that are not Planned Parenthood.
So if we wanted to support access to comprehensive health care services for women, would we be better off supporting abortion clinics or federally qualified health care centers?
Federally qualified health care centers.
Thank you. In 2005, a Planned Parenthood-funded study found a majority of women seeking an abortion did so because having a baby would interfere with education and work, cost too much, or they did not want to be a single mother or having relationship problems. What are your thoughts on the findings of this study?
It shows that it belies this notion that abortion is only used in very extreme cases. The extreme rare cases are typically used to cast pro-lifers into a negative, extremist, radical, misogynist light, which is just not accurate. The majority of abortions, according to Planned Parenthood's own research, are done on the basis of convenience. And I just don't see a logical or moral justification for killing an unborn child on the basis of them simply not being wanted.
Thank you. Madam Chair, earlier, Dr. McNicholas said that Dr. Williams was a physician and had taken an ethics oath and should know better than to do what he had done. I just want to quote from the classic Hippocratic Oath. Hippocratic oath. I'll use those regimes which will benefit my patients according to my greatest ability and judgment, and I'll do no harm or injustice to them. I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan, and similarly, I will not give a woman a pessary to cause an abortion. Dr. McNicholas, did you swear a Hippocratic oath when you were licensed?
I did, and I continue to live that every single day.
Amazing. Madam Chair, Mr. Roy asked me if I would enter into the record this article.
Without objection.
Thank you, Madam Chair. I yield back.